Okay, welcome to our lecture video series on microbiology for nurses. We are continuing with our series on viruses. So this is part 3, especially for viruses, and we said for part 1 we just looked at what viruses are, the general characteristics, the classification of viruses. Then part 2 we delved mostly on pathogenesis, and also apart from pathogenesis we looked at the replication process. Okay, and now today in part 3 we're going to look at medically significant viruses, because if we start looking at all the viruses we cannot finish. There's so many, so we're going to look at the ones that commonly affect human beings in their different classes. Okay, just before I start, I want to just give a shout out to KenyanNurse. This is a very good company, by the way, and this for nurses. It offers a wide array of services, but especially for nurses, like for nurses who want to go and work abroad. So they want an English test, IELTS. They do IELTS coaching. Actually, they're one of the best in Kenya and also in some parts of Africa. And then they also do NCLEX training for those nurses who want to go and work in the US, NMC-CBT training for the nurses who want to work in UK or become UK registered nurses. So they do very, very, very nice trainings, okay? Apart from that, they also do recruitment of nurses from African countries to the UK, to Ireland, to USA, to Australia. So they link you with this with this hospital that require nurses. They have just launched a very interesting new program called Overseas Journey Nursing School Admission. So this is basically aimed at admitting students to nursing school with the ultimate goal of these nurses qualifying and actually going and working abroad. Okay, so it's basically training nurses who will actually go and work abroad. This is, I think, this is a very interesting concept or program, especially if you are somebody who wants to not just to do nursing and then stay there. If you have a goal of going and working abroad, then that is a program for you. Okay, so I'll not talk so much. I'll put the link on my website of their website on the description below of this video, and then you can go and check out their sites, the social media sites, and their website. Okay, so you'll tag me later. So let's go back to our video content today. We are going to look at we said medically relevant viruses. So we're going to start with DNA viruses. So basically I've classified them into the DNA viruses and the RNA viruses, into these two major categories. Obviously we know there are other ways of classifying these viruses, whether they're double-stranded, single-stranded, what have you, all these other types of, whether they are actually enveloped or naked viruses. So all these ways of classifying them we have, but for purposes of making this very simple and easy to understand, we're going to look at DNA viruses and RNA viruses. So the ones that are medically relevant under DNA viruses, we have Adenoviruses, Poxviridae, it's a family. Then we have Papoviruses, Parvoviruses. We have herpes viruses. We're going to look at varicella viruses, cytomegalovirus, Epstein-Barr viruses. Okay. So these are the ones we're going to look at in depth. Obviously, we have so many other viruses like enteroviruses that we cannot look at all of them. Okay, but just picking some of them here and there. Okay, let's start with adenoviruses. So these are derived, the name adenoviruses, they're derived from the human adenoid tissues where they were first actually located, okay, or isolated. So the adenoviruses normally causes diseases like sore throat, okay, acute respiratory diseases, some different types of conjunctivitis. Okay, so we can have keratoconjunctivitis, swimming pool conjunctivitis. So that is what is common for adenoviruses. So these are examples of diseases that people develop when they have this adenovirus. So adenoviruses are very common in causing conjunctivitis and the sore throats. So there are family we look at is Poxviridae, and these are family of viruses that actually belong to the causative agent of smallpox. The smallpox is a very, very good example of the Poxviridae family of viruses. Others that we can have are cowpoxes, which are very important, buffalo pox, and Turner pox. Okay, so maybe we just mention about smallpox. This is how it appears. We have this um, sort of rashes or skin lesions that are formed. Okay, but at least we can say we have um, on WHO, one of the major achievements actually was complete eradication of smallpox cases. Okay, so and also thanks to Edward Jenner with his invention of the virulation of this vaccine for the smallpox. Okay, it was a very, very bad disease, and you could see how it would affect somebody. So that smallpox belongs in the family of Poxviridae. Okay, cowpox actually. How actually did Edward Jenner worked out the vaccination for smallpox? He took their women or the milkmaids who actually were milking the cows, and actually they were, because of the cows had cowpox, they were predisposed to the cowpox virus. So what happened? It gave them some sort of immunity against even smallpox. So actually, it was only the milkmaids whose skin was actually just nice and glowing because they were not getting smallpox. Okay, so through this observation, Edward Jenner was able to actually work something out, and the rest is history. So this is what they would get after actually milking the cows. You get the cowpox. Okay, those are the poxviridae. Now we look at papoviruses. Papoviruses, sorry. So these are small. Actually, together with the picornaviruses, papoviruses are also very small. So they're small, they're double-stranded DNA viruses. And the most important virus with regards to humans in this family is what we call the human papilloma virus, HPV. I know most people know it as one of the predisposing factors to, it has been linked to cervical cancer, but also other diseases like genital warts and skin warts. Okay, so this is an example of the male genital warts, how it will appear, and also for the female genital warts. So the HPV is very, it's known for that. Okay. Then for the family of herpes viridae, we can have, they consist of 80 viruses. And by these numbers, they keep adding up because more and more viruses are being discovered, and some of them are in this family. But up until now, 7 different herpes viruses have been isolated to actually and attributed to the man as the natural host. So we can have herpes simplex virus, which is divided into 2 types. We can have type 1, HSV1, or type 2. Okay, basically the same thing. The only difference is where it really affects the body. Okay, so with this, HSV1 affects the region above the waist. So it can be anywhere above the waist, you can have it affecting. So mostly it likes the corners of the mouth, some parts of the oral area. Type 2 likes anywhere of the region below the genitals, okay, or just below the waist. So you'll have the genitalia being affected, the anal region, maybe the thigh area. You'll have the effect of herpes simplex virus. Okay, so that is the major difference of the two. So HSV1, you can see the lesions that are found on the lips of the mouth, and this is HSV1. HSV2, this is a penis, and you can see the lesions that are seen there. Okay, that is herpes simplex. Then we have varicella zoster virus. This is the virus that is responsible for 2 diseases of man. Okay, so you have varicella zoster disease itself and herpes zoster. So varicella is what we normally know as chicken pox. Okay, chicken pox is varicella zoster. It is contagious. Normally, it causes generalized xanthomatous disease. So there's some eruptions of the skin, and you have these lesions on the skin. Then we have herpes zoster. Herpes zoster is known as shingles. one important thing you should know is that herpes zoster is basically varicella zoster, which normally goes into a latent phase in your body. Okay, you never completely lose these viruses once you have them. So the day that you have your immunity compromised, or you have some immunodeficiency of some sort, then herpes zoster pops up. Okay, then you have shingles. Its main characteristic basically is having a unilateral, painful vesicular eruption of the dermatomes. Okay, dermatomes like the nervous supply on specific areas of the skin. Okay, so just to see, these are chickenpox, varicella zoster, and shingles. We have, you can see the way it is following a dermatome here, okay, on the skin. So it's normally unilateral, not both sides, unilateral. Okay, there's another one, and you can see. Okay, very common also for people with immunodeficiency diseases like HIV. Then we have EpsteinBarr virus. These are viruses that actually has been linked to some sort of cancer. So we have Burkitt's lymphoma, which is a form of malignancy. So Epstein-Barr has been linked to, so it's not a very good virus. So this is how Burkitt's lymphoma patients look like, they present with. You have this tumor, especially growing from the oral cavity, from parts of your cheeks, and then growing. So it becomes so bad that it blocks the oral cavity and also blocks the nasal cavity. Okay, so the patient becomes unable to eat, even breathing becomes a problem, and other systemic problems of the cancer. Okay, so those are DNA viruses. Then now we can look at some, so mind you, those are not the only ones. So I've just looked at the ones that are common. You can go and look further into other ones. So let's go to RNA viruses. And you can see here an image of so many viruses, RNA viruses. I want to say here now, most diseases that have been attributed, which are have a high mortality rate, or they're very difficult to find vaccines on, are normally RNA viruses. Okay, so these are not good viruses. So case in point, we have like flaviviruses, where Ebola belongs. You have Rhabdoviridae, which we have the Rabies virus there. We have retroviruses, where we have the HIV. Okay, and we look at all this on Coronaviridae, where we have the coronavirus. So this becomes RNA viruses are not the best. Okay, so these are the ones that we will look at: HIV, Aboviruses, Rubella, Picornaviridae, Orthomyxoviridae, Paramyxoviridae, Rhabdoviridae, and Rotavirus. And obviously, because right now we're having this problem, we'll also look at coronaviruses. So this one, HIV, needs no introduction. I think it's human immunodeficiency virus is very common. As in, the content is very common. It has been with us for some time. It was one of the worst pandemics that has ever faced the human beings, and it's still ravaging some parts of the sub-Saharan Africa. So anyway, it belongs to the family of RNA viruses, and they are called retroviruses. Okay, if you go back to our lecture series on the classification, you'll know what retroviruses basically means, and using the Baltimore scheme of classification. So this virus leads to a disease called AIDS, which is acquired immunodeficiency syndrome. So syndrome is basically the symptoms that are clumped up together because of this disease. Okay, so these are classical pictures of people who have HIV. They're wasted, but with the advent of antiretroviral drugs, nowadays, this is not the actual picture. People can look healthy and everything, and yet they have it. Then we have arboviruses. These are viruses which multiply in the blood, sucking arthropods, and that's why they're called arboviruses. And they're transmitted to the vertebrates by a bite. Okay, so think of it. Just any arthropod you know, like a mosquito, okay, or any other fly, most flies or insects that you know. So the diseases that are mostly found in this family, we have dengue fever, yellow fever, chikungunya, Okay, chikungunya happened the other day in Mombasa. Yellow fever. Is there dengue fever? Dengue fever is also another disease. It is carried, that is found in these classes of viruses. Okay, so most of these present with hemorrhagic fever symptoms. Sometimes the hemorrhage is mostly the last, one of the last, sometimes not even seen symptoms. But the fever is one of the classical ways of knowing this. So dengue fever, chikungunya, it comes also with some sort of rashes, and yellow fever viruses. Then you have rubella virus, is also called the German measles. Okay, it's important. This virus is very important because it can cause congenital malformation. Okay, if the child if the mother is actually infected with it during the pregnancy. So sometimes it's good actually for women actually to be vaccinated against this, so that we don't have congenital malformations. So rubella virus. This is how it looks. You have a rash on the face, the neck, and the body. Okay, then we have Picorna viridae. That's a family of very, very small, tiny viruses. Pico means small. Okay, so the members of this family, we have polio viruses, hepatitis A virus, and some rhinoviruses. Okay, so polio virus is also an enterovirus. Okay, it's a virus that is also found in our tract. Hepatitis A virus. Okay, so we know hepatitis A and hepatitis E. Those are viruses that can be transmitted via the gastrointestinal system or the fecal-oral routes. And the hepatitis B, C, those are blood-borne viruses. Okay, so in this case, hepatitis A, poliovirus, these are viruses that can be transmitted in that manner. And then you have rhinoviruses, obviously, and they cause problems, especially with our sinuses. Okay, so this is poliomyelitis, and then we have the thing with poliomyelitis. Normally it causes infection. I think I'll do a whole lecture on poliomyelitis. So you normally have unilateral sort of deformity, okay, and you lose your ability. You just have become flaccid, and normally it's a sudden thing. Okay, so poliomyelitis, you become paralyzed in your limbs, and this is if you're actually lucky and you don't get the bulbospinal form, which basically will kill you. Then we have Orthomyxoviridae, and it's a family for influenza viruses. So influenza is normally found in Orthomyxoviridae. We have different types of influenza. By the way, influenza is a virus, but hemoinfluenza is a bacteria. So some people confuse this fact. So these are some signs and symptoms, and most of us have gotten the flu, and we basically know what we have. So we'll have respiratory problems, nasopharynx problems, joint pain, some fever, and all that, headache. Then we have para-myxoviridae, and the group here is para-influenza. Simple. Orthomyxoviridae, you have the influenza virus. Para-myxoviridae, you have the para-influenza virus. Then you have mumps viruses, the mumps virus, and the measles virus. Okay, so that is mumps, inflammation of the parotid gland, and then you have the measles, you have these rashes. Then you have rhabdoviridae. The rhabdoviridae, basically the rabies is found in this family. Okay, if you the rhabdoviridae has a very interesting characteristics of its structure of the virus. It looks like a bullet. Okay, so anyway, the rabies virus is one of the most common in this family that affects the human being. So what the person gets is the rabies disease. So hydrophobia is a main feature, and then patient starts convulsing when they start taking, when they try to take water, and then you have all these sorts of problems that comes with rabies, and normally it's transmitted through a bite by animals. Okay, so you can see a dog biting there. Good thing, at least we have anti-rabies vaccine. So once you have the bite, you can go to your health facility and actually get it. Then we have rotaviruses. So it is the single most important agent of infantile gastroenteritis, okay, throughout the world. So actually, like a place like Kenya, you get the vaccination for the rotavirus. Okay. So yeah, this is rotavirus in your gut, and uh, this is a kid getting the rotavirus vaccine. Finally, the coronaviruses, they're called corona because of they have this crown sort of shape on top of their envelope. Okay, that's what they call corona. So the family is called Coronaviridae, and it's an RNA virus. So what is here as the genetic material is RNA. We have different types that can cause different diseases. We have severe acute respiratory syndrome, CoV. So that is SARS-CoV, because the disease SARS, okay, just from the name severe acute respiratory syndrome. Then that was just in the 2003 or something. So these things have not been discovered a long time ago, just recent. Then we have Middle East Respiratory Syndrome coronavirus. That is the MERS-CoV, because the disease the MERS, which is Middle East Respiratory Syndrome. And the most recent one, COVID-19, is actually the virus itself. When it came up, they were calling it nCoV, meaning novel coronavirus, but the name changed. After now it was assigned an actual name, severe acute respiratory syndrome cov coronavirus 2. Okay, that's called SARS-CoV-2, which causes coronavirus disease 19, COVID-19. Okay, so those are the viruses that I thought of looking at. So kindly take your time to look at other viruses. So by no means I'm saying that these are all the viruses. So make sure you read much more. Okay. So kindly feel free. Remember to like and subscribe to our channel for more videos. Okay. Thank you very much.